Okay, thank
Thank
you,
you.
thank you, Dr. Quimins. Hello, everyone. My name is Muqi. I'm a postdoc research fellow at University of Michigan School of Public Health. I'm honored to be here and present my analysis on age at menopause and cognitive function among Chinese middle-aged and older women. This work is a collaborative effort with my fabulous co-authors Yin Yan, Alden, Carrie, and Lindsay. So China is facing an increasing burden of dementia, with 15 million people living with dementia and another 14 million with mild cognitive impairment. Compared to men, women had higher prevalence of dementia and cognitive impairment. To explain sex or gender differences in dementia risks, previous studies has explored multiple social and biological factors, such as women's longer life expectancy, which increased their chance of getting dementia at advanced ages. Also, women's lower education and a stronger impact of dementia risk factors, such as APOE genotype and brain injuries for women. And in recent years, there are emerging studies exploring women's unique reproductive factors and its role on dementia risks. Those reproductive experiences, such as pregnancy and menopause, involve substantial changes of estrogen. Estrogen is thought as a neuroprotective hormone. It can promote blood flow and reduce inflammation in the brain. So the experience of menopause represents a rapid decline in estrogen, which may disrupt the brain function and further lead to cognitive decline. Current evidence on the relationship between age at menopause and dementia showed mixed findings. Some studies found younger age at menopause is associated with higher risk of dementia or poor cognitive function or accelerated cognitive decline. But findings are not consistent across studies, and it may vary by the use of different set of confounding factors, such as age at menarche or contraceptive use, which are usually not available in dementia researches among older adults, and the differences in how menopause timing was operationalized and the selection of cognitive measures of different domains may also contribute to the inconsistencies. What's more, there are limited research on this topic in low and middle income countries, including China. However, in those countries, the distribution of age at menopause differs, with higher prevalence of premature or early menopause. And women in those countries, most of them have low awareness and use of hormone therapy for treating menopausal-related symptoms. So those unique context characteristics may lead to a different findings of age at menopause and dementia compared to findings in high-income countries. So the study used data from the China Health and Retirement Longitudinal Study. For this analysis, we focus on postmenopausal women with at least one wave of cognitive assessment data between 2011 and 2018. To exclude the possibility of surgical menopause, we excluded women with ovary, cervix, or other reproductive-related cancers. We also excluded women with missiness in key measures, including age at menopause, cognitive test, and covariates. As a result, this study included more than 7,000 women with more than 18,000 observations. So for the outcome measures, we use a composite score by summarizing several neuropsychological task performance, including subtracting 7 successfully from 100 and naming days, drawing a picture about the pentagons, and immediate and delayed word recall. And to make the scores comparable across waves, we standardized the cognitive score to its baseline distribution. The cognitive test was measured at each time of follow-up. For the exposure measure, we use self-reported age at menopause, and we categorize it into 5 age groups, and we use clinical cutoffs to define premature, early, and late menopause. We use a mixed effect linear regression model with random intercept and using the years since baseline as the time scale. We controlled a set of confounding factors measured at baseline into 3 models step by step. Those covariates include demographic and socioeconomic characteristics and also reproductive characteristics. Additionally, we controlled a set of interaction terms between years of follow-up and certain covariates to allow time-varying effect of covariates. To assess the potential heterogeneous effect, we conducted several subgroup analysis by median age at menarche, rural residency, education level, marital status, and years of postmenopausal experiences. To assess whether the study association is sensitive to the measurement of cognitive test, we conducted the sensitivity analysis by using individual cognitive tests as the outcome variables. Here are some results. The study women, on average aged 58 years old, 85% of them are married and 13% of them were widowed. About 78% of them living in rural region, and more than 90% of them had lower secondary or less education. So the distribution of age at menopause concentrated at age 50. And about 3% of them had premature menopause under age 40, 8% of them had early menopause between age 40 to 45, and about half of them had menopause between age 50 to 55, and another 5% of them had a late menopause after age 55. So the linear regression result shows that premature, early, and late menopause are associated with lower cognitive score compared to the reference group for women with menopause at age 50 to 55. And compared to the model with only demographic characteristics controlled, the study association attenuated after controlling for socioeconomic status. But the association didn't change much after further controlling for age at menarche and biological birth. In terms of the cognitive decline, the graph shows that the predicted cognitive score across years of follow-up since baseline by different groups of age at menopause. On the top, we can see our reference group, the women who had menopause at age 50 to 55. It shows a similar trend of decline as women with menopause at age 45 to 49. Next, below them are women with menopause between 40 to 44. In the bottom shows the cognitive decline among women with extreme menopausal age under 40 or after 55. As we can see, women with late menopause, the rate of their cognitive decline surpassed the rate of cognitive decline among women with premature menopause after age 40. Even though the linear regression didn't show statistical difference in the predicted cognitive score in the follow-up across groups of different groups of women with different age at menopause, but this graph still show a trend of different cognitive decline. So for the subgroup analysis, there is no statistical difference across groups, but we can see the study association appeared stronger among women who experienced menarche after age 16, lived in rural areas, or been married, had lower secondary or education, over more than 8 years of being postmenopausal prior to baseline interview. In terms of the sensitivity analysis by using individual cognitive tests, the results are similar to the main findings. So in summary, this study found a nonlinear relationship between menopause age and cognitive function among middle-aged and older Chinese women. And with higher prevalence of premature and early menopause, Chinese women are facing a higher burden of dementia compared to their counterpart in high-income countries. This study has two main strengths. First, compared to current relevant studies in China, which are usually cross-sectional, regional, with smaller sample size, this study added evidence on the association of age at menopause and cognitive decline using longitudinal data and a national sample. Compared to studies in other countries, this study enhanced the evidence on a nonlinear relationship and found the long-term implication of late menopause on rapid cognitive decline. But one major limitation of this study is the data quality of measuring timing of menopause. We relied on self-reported age at menopause, which may have recall bias. And additionally, there might be a varied understanding of age at menopause across Chinese women. The definition of menopause not provided in the child survey is the absence of menstrual period for at least 12 consecutive months. Chinese women may not know this definition. This particularly impact younger women who may reported whose reported age at menopause may be within 1 year prior to their age at time of interview. At present, we control their age at baseline in linear regressions, but in the future, we may need to conduct a sensitivity analysis by excluding those younger women. And another limitation is that this study is not causal, even though we have controlled as many covariates as possible. And the study relationship may have potential reverse causality. If women with cognitive impairment, if they were more likely to report their age at menopause at quite a younger or older age, the study association might be reversal. So next step, I may need to conduct another sensitivity by only focusing on women who had higher cognitive scores at baseline. Finally, we wanted to thank all trials participants who generously provide their personal information for scientific research. We are also thankful to the Gateway to Global Aging Data for providing harmonized trials data for analysis. And this study is funded by NIH-NIA. Their support is important for complete this analysis and disseminate study findings. Lastly, thank you all for your time and listening. Appreciate any of your questions and thought. Thank you.